After a local family's plight exposed the challenge of getting children the mental health care they need, another family is coming forward, pleading for help after finding themselves in a similar situation. Thanks for watching the news at 5 tonight. I'm David Custer.
And I'm Meg McLeod. Jay and Joanne Gross's struggle to find inpatient services for their teenage son quickly went viral, shining a light on what they describe as a broken system.
Tonight, TV5's Rachel McCreary shares another family story that sounds all too familiar and digs deeper into the problem in this TV5 investigation.
I've reached a point where I just feel so lost in that my daughter's going to die.
Nicole Norris is at her breaking point. Her 14-year-old daughter was hospitalized at Covenant Healthcare more than a week ago after an incident that required mental health care treatment.
Today is day 9, I believe. That my child has been sitting in a hospital room with absolutely no help for how she's feeling.
Norris reached out to TV5 after seeing our story about Jay Gross, a father who waited for over 2 weeks in a mid-Michigan hospital struggling to line up inpatient mental health care treatment for his 15-year-old son. Gross took to social media for help, shining a spotlight on the issue. The problem is similar for Norris. She says no mental health care treatment centers have room for her daughter. She also claims there's not enough access to immediate treatment.
This is about services that are provided in this area for kids that have severe mental health issues.
Bob Sheehan is with the Community Mental Health Association of Michigan. One of the biggest issues, he says, is placement at these facilities. According to a recent report provided by the Michigan Department of Health and Human Services, from 1993, the amount of beds available to children decreased from 729 beds to 276 in 2017.
There's not only a shortage of inpatient psychiatric beds, but the mix of beds and the needs of the patients don't match.
Sheehan adds that lack of staffing is an added strain.
The hospitals are trying to recruit, as we are in the community psychiatric staff, but there's a real drought when it comes to psychiatric staff.
Sheehan believes more needs to be done, but he says it will take time. His advice to Norris?
I think what she's doing by staying with her daughter, first of all, is number one. Secondly, continue to advocate that they call as many places as possible.
Sheehan says that COVID-19 has depleted mental health care resources and increased stress on those struggling with mental illness.
It's so terrible seeing my child suffering and I can't fix it.
In Saginaw, Rachel McCreary, WNEM, TV5.
We also reached out to Covenant Healthcare. They tell us they are doing everything they can to help those in their care. And even though they can't comment on this specific case, they sent us a statement saying in part, it's heartbreaking that people cannot receive emotional care at the time of need. And we hope that our state legislators will work together to help find solutions that make mental health care more available at the time of need. Now, TV5 will continue following the family's struggle and bring you any new updates.